I'll have you know that 1 out of 4 women still, especially those who are married, still feel they have unmet need for family planning. Now, upon interacting with some women, precisely from Western Kenya, most of them feel that if they knew about family planning alternatives earlier, maybe they would have avoided back-to-back pregnancies that are a bit straining in their health and, of course, finance. And who better to take us through than a family planning nurse expert who has just joined us in studio today. Welcome to Healthy Living. I'm your host, Faith Shikanga. Hello, Daktari.
Hello, Faith.
How are you doing?
I'm fine.
Orivlam. Okay.
Yeah.
Now, I would just want you to maybe introduce yourself to our lovely viewers beyond even this medical banner, who you are.
Okay, thank you, viewers. My name is Victoria Chiteri. I'm a nurse. I'm a family planning mentor. I'm a mentor in cancer screening, basically in reproductive health services. I work in a government facility and I enjoy dealing with women and fathers in a family planning clinic.
Okay. Now, for a young person listening, maybe, how would you describe family planning beyond the usual banner that we are used to knowing, avoiding pregnancy? How would you describe it? What does it actually entail?
Okay, thank you. In family planning, it's not only avoiding pregnancy, it's also getting wanted pregnancy. Yeah,
Okay.
So most people think that when I go for family planning, I'll not get pregnant. No.
Okay.
I can go for family planning because I'm planning to get my child after 10 years or after 5 years. So it's part of helping me to choose when to get that pregnancy,
Okay.
when to carry that baby, and also I need to maintain my health.
Yeah.
So I need to remain healthy to avoid frequent pregnancies. And also as a mother, you need to remain healthy to ensure that you can develop your career, you can develop in your farming because you are spacing your pregnancy. And also to our fathers. With the family planning, fathers are not only avoiding pregnancy, and they're also going to get that confidence because they are able to take their care of their family, take care of their children, give them the right education at the right time. And also when, as a father, when he walks out, find that he has well taken care of children and the wife is proud.
Okay.
So fathers are key factor in family planning.
Yeah, because I really wanted, and we'll really talk about their involvement, later. So I just want to, maybe in Kenya, precisely in Western Kenya, how do you think that most of the people, especially women, they have enough awareness about family planning, and of course, maybe some of the challenges that might come with it, just the awareness bit?
Okay, when you look at our Kenyan data, especially our western part of Kenya, we find that we still have so many people with unmet need of family planning.
Yeah.
They know there's that family planning, but they don't know where to get it and how to approach it. Because one, maybe they have some cultural views, cultural restrictions that are not allowing them to visit health facilities. But the family planning knowledge starts from our household level, starting from our community health promoters, our health facilities. When you go to our village barazas, we talk about family planning. And also, we want to involve the whole community in understanding this family planning. So our women, our young girls, they should know that family planning is there and it's safe and it is free.
Okay. Yeah, and I'm just glad that you are very clear about the free part, because one would always want to know that one step, because most of the fear is maybe I would be charged a certain amount. Now, I just want to know, maybe if a patient, if somebody walks in your facility, do we have certain factors, that one factor that you would consider before recommending a certain type of family planning?
Yes, there are some issues that you have to put in consideration before starting family planning. When you visit my clinic, I should understand your fertility rate. When do you want to get a baby? What is your goal of using this family planning? Maybe you say, I want to go to study. I don't want to have a baby for the next 10 years. So you should start talking about the long-term method. Something that can keep you for that 10 years. And then you'll come back to get a baby. Or maybe you're coming to my family planning or the family planning clinic. I don't want to have a child.
Yeah.
So we have also other permanent methods.
Yeah.
So in family planning, you have the temporary and the permanent method. So when you come in the clinic, we discuss. You have said, I want to have a baby after 5 years, or I don't want to get a baby. So we shall talk basing on your fertility choice.
Yeah.
Another thing, we look at the health factors. Do you have any other underlying condition that can be a contraindication to the method of family planning that you are having?
Yeah.
We look at your social habits. Are you a smoker, a drinker? No, when you are a smoker, it will interfere with the hormonal methods. Also, we look at your social circle.
Okay.
So that I only have time maybe once in a year to visit the facility. Why should I give you a method that requires you to be coming to the facility every month? And also in family planning, talk about the self-care. Is it a method that I can manage myself at home, or I should be visiting the health facility frequently?
Nice. So it's still on what you normally consider. Do we have something maybe called age-related considerations? Maybe if somebody is young, there's an ideal family planning for you. Maybe if somebody is young, or a mother who is breastfeeding, or maybe a woman who is nearing menopause.
Okay, thank you. In family planning, we also look at factors like the age. Let's say this is a mother who has delivered, the baby is less than 6 months. There's some method that she will not be allowed, she cannot use, because it will interfere with milk production.
Yeah.
Let's say she has just delivered. Nowadays, we start family planning immediately we deliver the placenta. Because this mother, they don't have time to visit the facility every time. They are busy, and we want all our women to be economically empowered.
Yeah.
So after delivering, you start the method that will be safe both to you, to your child, and to your partner.
Okay.
Because a family planning is something that should bring peace, should bring happiness and joy in the family, and should strengthen that family unit. Okay, when you are a young girl, you want a method that will not delay your return to fertility when you want to have your baby.
Yeah.
So we shall discuss basing on the individual plan. I have come, maybe I'm 20 years, I want to delay pregnancy for 2 years, but after 3 years I want to get pregnant. So there's a method that can delay return to fertility, which we cannot advise you to use.
Now, still on that, maybe in the same breath, you've mentioned about the return of fertility. So I just want to know, maybe how long do you think can somebody take to resume back her fertility?
After?
How long can one take, maybe basing on a different family planning she's using? Because there's that one particular, especially for the young people, there's that one particular time she'll feel, now I'm ready to have it. How long does it take for you to restore your fertility?
Okay, basing on the family planning method, we have some that return to fertilities immediately.
Oh, okay.
Example, you are using a long-term method, like an intrauterine device, the UCD. Immediately we remove it, return to fertility will be immediately.
Okay.
Even the implants, the 5-year, the 3-year. But also basing on return to fertility, there are some other factors we have to put into consideration. Ensure that we don't have any infection. Okay. In screening for family planning, we screen for other health conditions. Do you have a sexually transmitted infection? How can you prevent it? As much as we are preventing pregnancy, we should also prevent this sexually transmitted infection that can lead to infertility.
Okay.
The worst being gonorrhea. Can lead to having your secondary infertility. So when we ensure that there is no any other infection, you're using family planning. When you want to terminate the family planning method, it should be a method that can allow you to conceive immediately.
Okay.
And then we have some other methods like our injection. Some may delay up to 12 months before return to fertility, before you conceive again.
Okay.
So when you are counseling, you advise basing on when do you want to have a baby. I want to have a baby after 3 years. Immediately I remove my implant, the 3-year implant. I want to conceive immediately because I have some other future plans. So looking at in each method, which one would be most comfortable to you, and because when you want your fertility to return.
Okay. Now, before even somebody gets into the whole family planning, I just want to know, maybe, is it crucial for this woman to go through some kind of examination, or maybe an assessment test, if there is, for this family planning? Okay, when you visit our clinic, the first thing we shall take history, as I said earlier, the medical history. Do you have any other underlying condition that will not allow you to use a specific family planning method?
We screen for health conditions. We screen for blood hypertension. We shall screen for diabetes. Do you have are you on any medication that can interfere with the efficacy of the method that you are using? And also we shall look at your weight.
Okay.
Maybe you are overweight.
Oh.
Which might interfere with the type of method that you want.
So weight is a factor.
Yeah, we also consider the weight. Maybe you are at around 150 kg and also you want hormonal contraceptive. You know, the weight will lead to lower absorption of the hormone. Yeah. Which might make you fail the method.
Now, I would just want to know, let us now shift to how effective these methods are. Now, let's say, you know, Kenyan Gen Zs, you know how they are. We like it when things are a bit instant. We want instant results. So how can one know maybe that particular family planning method that is compatible with them and that can be more effective?
Okay, with the now we shall say on individual basis. You have come to the clinic, I've checked, your weight is okay, the blood pressure is okay, your fertility desire is okay because you want maybe 10 years, so we are talking about 10 years. And also look at something that more flexible to you because GNC, they will not have time to come to the clinic every time. In fact, that issue of queuing to them is just another problem. So we make their time also to be flexible. When they come to the hospital or to the facility, watakwambia sina time. In fact, most of them tell you sina time.
True.
So we take them through the session. They take a method that is more convenient to them.
Okay.
Hawa watakuwa na kurudi hospitali kumeza dawa kila siku, anakuambia sina time.
Okay.
So I give them a method that is safe for them and will not interfere with their fertility.
Now, which method would you recommend that is more effective for somebody who wants an maybe 99% effective?
Okay, the most 99% effective method we talk about intrauterine device and the implants.
The implants.
They are 99. So you have one failure in 100 births.
Okay. Now, there's this story we had of a woman who was, in fact, it was just in Kakamega, of a woman who was using a certain type of family planning, and of course it just didn't work. Now, according to me, I think that was news. So I just want to know, maybe, can family planning fail to work?
Yes, it can fail. That's why we are saying 99% effectiveness, you have 91% effectiveness. So before you start family planning, we look at, are you on any other medications? Some antibiotics will interfere with the absorption of the hormones or of the method, which might lead it to fail. And your hobbies, you are a smoker. It will interfere with the absorption of the hormones in the contraceptive method. Maybe you are a drunkard. You will forget to take your pill. You will conceive. Or maybe you have said, I'm a drunkard, no, it's my social life, but I'm
But if somebody uses it correctly.
If you use it correctly, it will not fail.
100% daktari?
It will not fail, apart from the 1% in the 99%.
Okay. Now, I just want to talk about the UDS and of course the implants, which are the most effective ones. What do you think makes them more effective than the other options?
One, with the implants, you don't have time to come to the hospital every time. Hakuna wakati wa, I've forgotten to take my pill. I've forgotten to put on that condom. I've forgotten to go and do my refill. No. Like let's take example of an implant of a 3 year. When you come, we insert the implant 3 year, you go home. We'll see you back after 6 weeks to check your menstrual cycle. Is it regular or irregular? After 6 months, we check again. We assess your menstrual flow. Then after that, you'll come back when you want to remove it. See, you'll have time to do other activities. So it will be more effective, more convenient to you. To our students, to our busy ladies, even to the family. Utakuwa unaambia mzee nataka fare kwenda clinic.
Okay.
No, clinic pia wanaitisha fare.
Of course, clinic pia wanaitisha fare. Now, let's move to a topic that even most of the people would want to know. This is something, if somebody is getting some use of maybe some method of family planning, this is something they will always want to be in the loop about. Talk about the side effects. So before even getting to the actual side effects somebody would expect, I want you to distinguish between a normal sign and that might be maybe suspicious or that might be caused because of a certain side effect. Just the distinction between a normal experience, because kuna ile mnaona tu you are expected, especially kuna ile just a normal experience and an experience that might be of side effect, and maybe it might just be telling you that it is time for you to switch your family planning method.
Okay, looking at a family planning method, everything has a side effect, the normal one and the adverse one.
Yeah.
Let's say an example, when you're taking oral contraceptive, the pill, you'll feel the side effect like nausea.
Yeah.
You feel like you are pregnant. That is normal. After 7 days, it will be off.
Yeah.
Okay, when you are using the implants, the implants, you start them on your arm.
Yeah.
And we do it cosmetically. Usifikiri itakuwa inaonekana vibaya.
I don't know why it's like the most scary family planning I can say from
okay. So even the implants might have menstrual changes.
Yeah.
Which will be minimal to some. Some will experience light flow or bleeding in between the periods or in between the menses for a period of 3 to 6 months. Then it will come back to normal. But if you exceed your normal flow days, it is not normal. Come back to the health facility. That's why we say after inserting the implant, we shall need you back after 6 weeks to assess how is your flow. And then another visit after 6 months to assess how is your flow. Is it now back to normal? When it's normal, it's okay. Some even will miss their menses when they're on the implants. It's normal. Because one, the hormone will ensure that it will inhibit in ovulation, and then it will ensure that the uterus will not be able to shed for the flow. So when you miss your menses, it's okay. You are safe. Hakuna mali damu imekwama.
Okay.
Yeah.
So that is now side effects.
That's a normal.
Yeah. That is expected.
It's expected.
Now,
but when you bleed excess, maybe let's say your cycle lasts for 3 days, but now you are going 7 days.
Yeah.
That's much. Come back to the health facility. Talk to your family provider. He or she will advise you accordingly, and even will give you some medication to regulate the flow.
Okay. So now that is something that is adverse. So maybe if you could just dig deeper with now the adverse effects, if you can just outline them to tell us maybe if you experience this apart from overflow, if you experience this, it might be, there is need for you to visit back your doctor.
Okay, you are on that family planning, you are assessing your blood pressure. You find out the blood pressure started going up, visit your doctor.
Okay.
Also, we have this severe headache.
Oh.
I've been okay, I'm sleeping well, I'm well rehydrated, but I'm getting that headache. Visit your doctor and assess, why are you having this headache?
Severe headache.
And maybe you have severe mood changes.
Oh.
Yani uko tu irritable kila wakati. Come back to the facility. We'll just assess, is it the family planning or we are having some other mental issues.
Okay.
And also if you find that you're using this method and it's affecting your sexual life, just come back to the facility.
Okay. Now, still on that, one worry about most of the women, it's a growing worry, is that the use of family planning might temper their outer look. Of course, we are talking about weight, gaining weight, or even some skin issues. Is that even expected in the first place, Amma?
Yeah, like we have our hormonal IUD, some might, very few, I think 1 in 10, might experience that acne, your pimple, but then it disappears after some time. But if it persists, come back to the facility. And then the weight, gaining weight.
That is even the biggest worry, doctor.
Okay. When you are using family planning, some will relax, ndio? I think I don't have any worry of getting children. Alafu anakula excess. Weight inakuja. Alafu unaweza kusema ni family planning. So when you are gaining more weight, we shall assess your diet. Maybe wakati niliweka family planning kasema sasa sina shida na mtoto. Nikaanza kulipisha kwa chakula. Sitaongeza weight.
Okay.
So let's assess also your diet. Why are you gaining weight? Some will gain weight sio kwa sababu ya family planning. Maybe akona mental issue. Do you know depression, somebody can gain excess weight? Kwa sababu hasira anapeleka kwa fatty diet.
Yeah. Ana switch kwa chakula.
Anapelekea chakula hasira. So, when you are gaining weight, you come back to the facility, we evaluate, why are you gaining this weight? Atakwambia nyewe, even I'm not eating that excess. But when you assess some mental issues, kuna something more to that gaining weight.
Now,
but ideally, with the most methods, people are maintaining their weight.
Okay.
And the long-term method, wengi wamependa because I maintain my weight. If I had the excess fats, the abnormal weight, sinaanza kurudi back to normal.
Now, you've talked about the long-term method. So, can we look at the long-term health issues that might arise because somebody is using a particular method of family planning?
Okay, like the long-term health issues, there's none that have been documented because some even have used oral contraceptives for the last 15 years, the last 20 years. They are safe. Some have been using intrauterine device throughout, maybe first pregnancy, alitumia paka the first born around 30 years, she has been using IUD. Anatoa kipata mimba, anarudisha. So it's safe.
Okay.
And also when you're using family planning, we have some health checks we do. We check our breast. Is it okay? And also as a lady, you have to check the status of your cervix after every 3 years. Is it healthy? When you're having issues, same in family planning, maybe you've got some other infection that was not treated. And routine health checkup about your screening your whole body, blood pressure, how is my sugar level? Because diabetes can set any time. Easy in family planning, it's just because of our diet. Also, you have to check this issue, check diabetes, check your sugars, check your pressure, monitor your weight, monitor your mental health, check any changes in your breast and in your cervix.
Okay.
Because hizo long-term health issues mnasema, it was something that was missed even before starting the family planning, that was not taken care of. Unapata alienda kwa clinic, she was given a method, a private clinic, maybe in a chemist. They didn't check her blood pressure, they didn't check her breast, they didn't rule out any other health condition akonayo, na wakamuanzisha. Maybe she is a patient with a heart problem.
So a procedure was missed.
A procedure was missed. So we say, go to trained health practitioners, well known, wakufanyie full check-up. Useme kwa sababu uko line ni fupi, acha nikimbie. Hapana. Your health sio vitu ya kwenda njia mkato. Do the right thing. Penda tu your health.
Now, before we get into infertility and how that can be related to family planning, let us look at the natural methods of family planning. You know, just last week, somebody else told me that don't say that you're not using family planning. It's just that you're using the natural methods of family planning. Take us even through what natural methods of family planning to that viewer maybe who might not be in the loop.
Okay, in family planning, we have the natural method, we have the hormonal method, and we have the permanent method. Looking at the permanent method, let me start from down. Looking at the permanent method, this is a method that cannot be reversed. Maybe you have had a desired number of children, now unasema, let me go for the permanent method. The permanent method, you can do to the man or to the lady. We say the vasectomy and the tubal ligation. And then you look at the hormonal method. The hormonal method, we have the implants, we have the oral contraceptives, the pill, we have the injectables, the common known as Depo, we have the IUCD, intrauterine device, we have the hormonal one, either 3 years, 5 years, and then we have another IUCD that is non-hormonal. And then now going back to our natural method. Our natural method, this one based on your calendar. You understand your body. When am I safe and when am I not safe? And this one is only practiced to somebody who has taken note of her period for more than 3 to 4 months. Unaelewa my cycle is between 21 say to 28 days or 29 days or 35 days. It has remained constant.
Yeah, that was my next question, Daktari, because at times you might keep that calendar, but then it alternates and it changes. Yeah, so if you have the idea of, I know my safe days, you might just get it wrong.
Yeah, so that's why I say, understand your cycle for 3 to 4 months before start using natural method. So you understand in your calendar, when am I ovulating? and when am I safe? Let's say example of somebody who is a 28-day cycle. It has remained constant for the last 4 months or 5 months. I know I'll be ovulating anytime after my 11th day. We count day 1 from the day you are seeing your period. Day 1 of your bleeding is the day 1 of your cycle. So you count, say maybe from day 10, from day 10 to around day 14, I'm not safe.
Okay.
But then with the natural, you must practice that thing with your, if you are married, your partner should also understand. Ndasema hauko safe, ni amesema hapana. So this one lazima as a couple, for the married people, we say we discuss natural family planning na how wote wawili.
Okay.
This man can help the lady to understand her cycle also. Also there's another one known as basing on your body temperature. We know when you take our temperature, it will be constant. But sometimes it will drop a bit kidogo. Especially that's the time that we are ovulating. Ikidrop kidogo, nawe aji yako iko juu. So your partner must also be supporting. Sema, tulisema tutaki mtoto. So after understanding your cycle, you can use the natural method. And also among the natural method, kuna zile pia tunasema the beads. Hata kama
enlighten us, enlighten us about the beads.
Okay. There we also have a bead at 28, basing on a 28-day cycle, 26-day cycle. Hiyo bead iko color coded. Sasa kiona kala fulana anasema leo hiki nakaa afaa nikae mbali. Or akiona umeweka red mahali najua she's now bleeding. So with the natural method 1, mentally you should be stable. And also you should ensure that you understand your cycle very well. And if you know you are traveling a lot, sometimes it will interfere.
It does.
It will interfere. Because umeenda kwa high attitude, the low attitude, stress za kazi. Umejua with the ovulation, family planning, our cycle inaanzia kwa brain. Ikiwa more stressed, the hormone pia itakuwa affected. Which will interfere with your cycle. Because when you're traveling, you might get your periods when you least expected. Yes.
It does happen. Now, still on the natural methods, maybe, do you think they can be reliable, daktari? The calendar way of knowing your safe days, because I think
knowing your safe days, effectiveness around 76%. Meaning, it has a high failure rate of around 25 or 24%. Around 24 mothers can get pregnant, 24 in 100. So in effectiveness, 75% might not be safe to all mothers. But some are using it because of their religion or belief, and they have been practicing it well. Wameelewa kabisa as a family and as a couple. Wanaielewa vizuri. So those who are using it correctly will be effective. But ukijua ukuna ishi, it will affect you.
And it's a method that should be considered with both partners, because especially if somebody is married, the man has to always know the safety.
When in a married partner, the man has to know, and also have to help you to understand your cycle. Because umesema now ovulating, nitapata mimba, sitaki mimba, na wewe mwenyewe ndio umekataa. So your partner in family planning, men involvement, they are key. They help us a lot.
Very true. Now, do you think any other method that you think maybe might cause permanent infertility? Do we have such a method of family planning?
No. There's no method that can cause permanent infertility.
It is a myth.
It is a myth. Because they say, no, in our community they believe usipopata mimba you are infertile. Maybe hujapata mimba because you don't want that baby. And you have not informed your in-laws that you are using family planning, because it's now a private issue that is only between you and your spouse. And the people in the community will expect you kiingia kwa familia mimba.
Especially in Western Kenya.
In Western, ukiona miezi 6, madhila anaanza kuangalia.
Raising eyebrows hapo hivyo. So maybe I would just want to know, I'm just glad to mention Western Kenya. And there's a way that I cannot even call it a myth. Nikita myth watu watasema ni kama I'm saying I'm trying to think of them as people who are not quite knowledgeable. Even for that person who has the basics of medicine, there's that one thing they normally think, and maybe it's a myth. So maybe if you can just distinguish, tell us some of the myths that are normally circulating around family planning methods that is not actually true. So the mythical bit and the factual bit.
Okay, some will say that when you're using family planning, you will not get pregnant.
I've heard it
infertile.
many times.
People will say, that one cannot get pregnant. That is a myth.
Okay.
But the fact is, you are using family planning because you don't want that unwanted pregnancy. I'm spacing. I want to have a children that I can manage. Niseme wenda ishi kwa auntie, go and stay with your uncle. No.
Because you feel the strain.
Yes, strain. And want children that I can manage to take to school. And also that I can empower. Sio kupeleka tu shule peke yake. Have to empower them.
Okay.
And also, there's another myth that when a woman uses family planning, atakataa bwana. I think, I don't know, mwili inakuwa baridi.
Mwili inakuwa baridi. And you don't, okay, as a woman kuna venye, you don't feel the urge.
Yeah, wanasema mwili inakuwa baridi. We say, when you are experiencing such reduced libido, come back to the health facility. Maybe you have fear.
Okay.
Yeah, that thing also is so mental. If I have fear, I will not have that urge.
Okay.
Or maybe alinikasirisha, nikimwona still thinking of that. Those who come with the reduced, we talk, unapata yenyewe kuna siku alinikosea. Sasa, bado, mentally jahil.
Okay.
But now after counseling, we assess everything is okay, but body may persist. You can change the method. You can switch to another method that will be more effective to you. Also, there is a myth that somebody when using family planning like the intrauterine device, their UCD, itapotelea kwa mwili. I always ask them, ushaona mtoto akipotea kwa tumbo? Because that thing we do it in the uterus. Kwenye mtoto anakaa. Ushaona mtoto alikuja akaenda kwa moyo? The uterine muscles, vile ziko arranged, cannot allow even that small thing kutoka. It's just a myth. And somebody will tell you that hiyo kitu ni mbaya itapotea. If you go back slowly, anaitumia na anaienjoy.
Wow.
And then some will say, ukitumia mtoto atatoka nayo. Because we expect those failure, and that's 1%. That's why we say with when you have an intrauterine device, we do check up after 6 weeks. Shall come check up after 3 months, then 6 months. Tujua iko safe, and also you are counseled on how to monitor your flow. Some might have those heavy cramps na expel. Ukiona, come back to the hospital, waweke tena. Because the people have different physique.
Now, even as we wrap up, let's look at this common family planning method that most of the young people normally use, of course, a condom. So maybe I just want to know, what are some of the side effects? Because people fail to, it's like to them it's 100%. Does it have some side effects if constantly used?
Okay, like when you look at condom, we say it's 100% effective.
Very.
Because it prevents unwanted pregnancy and it prevents sexually transmitted infection. Worse being HIV and the cervical cancers. And now we are having hepatitis hapo kwa sexually transmitted infection. So when condoms are used correctly, it is safe and it's the best.
It doesn't come with any irritation?
So with the irritation depend, are you reacting on rubber? Those who are reacting on latex might get irritation. But this time we have types that have been made that are thin, that hazina hizo latex, iko safe. So we say when you go to buy, unaangalia, unaambia mimi situmii, I react on latex.
Please.
I react on latex. Sasa kuna zile ambazo haziko latex. Ukiangalia, siku hizi kuna different brands and even kuna with the different flavors. Unachoose yenye unataka.
Very true. I hope that is very clear. Now, maybe according to women who might have very chronic disease, maybe they're diabetic or even HIV positive, how would family planning services be tailored to such women?
Okay, like those who are HIV positive, we do our care, comprehensive care as a supermarket. When you enter into our CCC or the comprehensive care clinics or in our facility, kuna unapata ARVs, unapata family planning services under the same roof.
Okay.
Si eti niende nipange line nyingine tena. We do it under the same roof. So that HIV positive, siku hizi wakitaka mtoto ndio wanapata.
Okay.
Si eti kuwashtua. They plan for that baby looking at also their health status. Are they now healthy enough to carry the baby? And also in our diabetic clinic, we have not denied them not to get pregnant. They get pregnant, but they plan. And there are methods safe for them.
Okay. Now, your final remarks, a message to our viewers regarding family planning and, of course, reproductive health.
Okay. Viewers, family planning is safe and it's best and it is good. So in our family planning, let us involve our partners. When we are coming to our family planning clinic, let's come with our partners because they are key players in our family. When you involve your partner in your family planning method of choice, it will be easy for you to manage. Even if there are any other side effect, he'll help you to identify the abnormals from normals, and then you come back to the health facility. It is a free service given to all our government facilities. And our reproductive health, it is our right. When you come to a facility, reproductive health, it's your right as a woman or as a couple. Or even as a man. Come to with your lady to the clinic. Ask more about your reproductive health. Check your reproductive health status. Ensure that you are healthy. You are ready to have that baby. Maybe you don't want to have that baby. You want to have time with your wife. It's good when you slay around with your partner. Squeeze hata wazee mpeleke wa mama out because she's not pregnant every time. And also this lady will continue being smart and you'll be happy moving around with her because mtoto amekuwa mkubwa, amemwacha pale nyumbani. You have time. Now you continue with your honeymoon and mko ameacha kidogo.
Okay. Now maybe as a county government, do we have any support groups that you think it will help awareness for family planning in Western Kenya, with Kakamega County within? Okay, in Kakamega County we have a group with the teen mothers that they are doing family planning. Okay. We have some NGOs supporting teen mothers, and even in our clinic we have our teen mothers support group that will encourage them about family planning, about breastfeeding, about empowerment. Even have some group that they have started their own activities, income generating. As much as they talk about family planning, they talk about breastfeeding, they talk about economic empowerment. Kuna wale wanafuga kuku, kuna wale wanashona. Very thoughtful of you, Daktari. Thank you so much for gracing our show. Nashukuru sana. Now it has been a very educative session. In fact, this is, like I always say, this is not an interview. Every single day I always feel like I have learned something new. Now more than ever, I know the right and the very appropriate family planning method that I can use as a person. And I hope the same applies to our lovely viewers. I've been your host, Faith Shikanga, and this is Amaica Health Living.